Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie,
And my name is Sara.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Today we have a lovely guest. I can't wait to introduce him. Actually, Sarah's going to introduce him. But how about Sara, you take it away?
Absolutely. So I'm excited to introduce David today. He has been a pediatric oncology nurse for 13 years. He's also a dad to 2 young children, and his book called Nurse Papa will be released later in 2021 by Gen Z Press. In it, David explores the unique intersection of his life as a pediatric nurse and his life as a parent. His podcast, also called Nurse Papa, offers a humorous perspective on parenting and life beyond. It can be found on all podcast platforms. Welcome, David, aka Nurse Papa. What should we be calling you for this episode?
I'm going to let you take that one. You can call me David, but if you feel like the Nurse Papa vibe is good, you can call me Nurse Papa.
Awesome. I think this is a first. I think this is the first time we've had someone with an actual moniker. So, we'll kind of alternate, see what we feel like. But it's really cool because we actually haven't talked too much about nursing and parenting, and we haven't had anyone that's a pediatric oncology nurse. So maybe you could just start by telling us a little bit more about yourself and how you got into nursing, and maybe even how you got into pediatric oncology.
Yeah, it was a long and untested journey. I didn't plan any of it, which is kind of how most of my life has gone. Um, Before I was a nurse, I was a painter and sculptor, and I thought that was what my life was going to be. I was going to make art and not make much money, and I was okay with that. But at some point, I felt like I needed to reach out and kind of be more involved with people. And that's when I decided to go to nursing school, which I did. I'm not sure how it is in Canada, but my program, you actually had to choose what kind of nurse you wanted to be before you got into the program.
Oh, really? No, it's not like
That's
that
really
here.
challenging.
Yeah, and that's probably not particular to every program in America, but that was my program, the one I actually wanted to go to. So I had no idea what to do. I chose adult acute care, which is what most of the males in the program chose, and was fairly happy with that. But fortunately, I had the opportunity to work pediatric rotation while I was in school, and I have to say that moment absolutely changed the trajectory of my life, career-wise and personally. And it's just one of those moments where you realize what you're supposed to be doing. I walked into a room because the nurse who I was working with asked me to calm down a child that was screaming in there, and I saw this tiny little girl. She was like 2 or 3 years old, and she had a syndrome called Stevens-Johnson syndrome. I don't know if you guys know what that is, but it's an autoimmune disease that it causes every inch of your skin, including inside your mouth, everywhere, to break out into these horrible sores. And she was in absolute agony, and I had absolutely no idea what to do with her. I was not a dad. I had very little experience with kids. So I just walked up to her, I picked her up, and I started singing to her, a song that I had been working on in my head for a while. And she looked at me, and she stopped crying, and she put her thumb in her mouth, and she just, sat there with me, and we rocked back and forth. And in that moment, I knew I was supposed to be a pediatric nurse. I didn't know it was going to be oncology, but that night I sat there in bed just thinking about it, and everything made so much sense to me in a way that it never did before. So the next day I went to my advisor and told her I was going to switch my specialties to pediatrics, and I had to drop out of the program to do that because most schools
Oh
aren't
man.
flexible enough to deal with people's passions. They want to put you in a box. Um,
Mm-hmm. Mm-hmm.
and that's what led me to pediatrics.
Wow, that's amazing.
That's a powerful story. Like, I mean, like I think about myself because, like, I mean, I remember my peds rotation, and yeah, there were a lot of screaming children, and I was like, nope, no, 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 I don't want to do this. And then also just the fear of, like, I mean, I knew I wanted kids one of these days. Well, I mean, back then, and I was always afraid of being like, can I be that person to take care of someone who's super ill and that has, like maybe a really serious thing wrong with them? Can I, not that I couldn't be compassionate, but maybe I'd be like over compassionate, right? Maybe it's just like I'm projecting my own feelings. I was just like, I don't know. I think I can do the education of pediatrics, but I think taking care of a sick child, I think that you got to be a special type of person to do that. And also the screaming, like, I don't know, that's a whole other
Mm-hmm.
gem too. You got to be a,
Yeah, I mean, you
Yeah.
definitely have to be a particular type of person. Um, but I think that's true with every specialty, right? Like,
mhm.
not everybody could be a NICU nurse, not everybody could do med surge, not everybody could be, a heart nurse. I feel like we all have these callings that we hopefully find our way to, and when you're there, right? You know
Yes.
when you've hit the right spot.
Mm-hmm, mm-hmm. You feel it. And
Yeah.
it's interesting that you said that you picked the adult patients because, and you said this is kind of a typical choice because from what I have seen with other male nurses, they typically will pick emerge or ortho or mental health. And you had said that you felt like you had to sort of put yourself into a box. And then you decided you wanted to go into pediatrics. Did you feel like people expected you to do something else? Like, are there many male nurses that work in pediatrics?
There are male nurses who work on my floor. It's not very many. I'd say out of the 150
Okay.
nurses there are probably 10. Um,
Hmm.
but they're a particular type of guy. So yeah, I mean, and it's probably a box I put on myself, right? That's what society does. Like, it kind of makes you feel like you were supposed to be somebody who you may or may not be. But a lot of that pressure is, what we internally place on ourselves. And I also had no idea what I wanted to do, and it just seemed like a pretty typical good place to start. But I'm glad that I found something else. I don't think I'd want to work with adults. I don't think that would be something I would thrive in the way I do
Hmm.
with pediatrics.
That's called self-awareness. So I mean, that's good that, because there's some people that they try a variety of different things and they're just like, they don't find it until, they've hit their third or fourth or fifth, career choice. And if you know it, that's just self-awareness. You're just like, yeah, I found this out early. I know this about myself. Then you hit the ground running and you don't have to deal with all the other BS. You don't have to deal with all the minutia in between. And I mean, I think it's honorable. Like, I think, yeah, lots of people put boxes around people, say, you can't work here, you can't work there. My best experience in labor and delivery was with a male labor and delivery nurse. I was like, yeah, send that guy in because he has better compassion than you women here. So, like, don't worry about what society has to say. Screw them. Do the right thing. Do what your heart and your passion tells you. But so what do you think? So we're kind of moving away a little bit from kind of your background and some of the work that you did, but maybe you can kind of tell us a little bit about what do you think some of the struggles are that nurses who are parents actually face. I'm sure you have more than enough stories to kind of throw at us, and we have our own too. But what do you think some of the main challenges and struggles are?
I mean, I think there are many. The first is that, when you're a nurse in the hospital, me specifically to children, um, you're a caregiver and you are taking care of kids in very difficult situations. They're often in pain. They're often unhappy. They often have parents who are unhappy,
Mm.
because their kids are very sick, you know, but they're usually very thankful for that care. But then you go home and you're also a caregiver. You're taking care of your kids, and they're often very
Yep. Yep.
non-thankful for
You
what
got
you do
that.
for them.
That's the truth. Oh my
And I
god.
absolutely do not expect them to be. I mean, it's my job to be a dad. I do appreciate a please and thank you every now and then. That is not coerced. But yeah, I think that's the first major difficulty in being a pediatric nurse, especially, is that you're 24/7 a caregiver, and that can be a really wearing thing. And it's hard to get some perspective away from taking care of people, finding that time for yourself to, um, to realize who you are and to maybe find some self-awareness, which is always a very
Mm-hmm.
fleeting thing for me.
You're being way too hard on yourself.
But I think another really difficult thing for me in particular is kind of crossing that barrier from hospital to home. I feel like I have to hold a lot of pain for what these kids experience. You know, they're sick.
Mm-hmm.
They often die. Their parents. I can't even imagine what they have to go through. I mean, I try to because I am a dad. Um, what do I do with that pain when I get home to my kids? How do I hold it? What becomes of it? And do I try to compartmentalize away from that? In this new environment, and I've tried to do that. I've tried to ignore it, but I've found that that's not really a great way to be. And I've tried to have that be part of who I am as a parent too. For instance, I talk about in my book about taking care of a child after they've passed away, and on our floor in particular, it's very ritualized. We give a child a bath, we care for them, we get them ready for wherever this new place they are that they're going to, and then I go home, I take care of my kids, and I give them a bath, trying to mend the space between these two worlds and find the grace in it can be really, really challenging. But it also is really a great thing for me to be thankful for because, I have healthy kids and I'm so lucky. It
Mm-hmm.
is a hard cross to bear, but it is also such a incredible opportunity to be thankful for what I have.
Mm-hmm. I agree with the thankfulness part, and also knowing all of the things that could go wrong, even though your kids are healthy. Like, sometimes illnesses just pop up out of nowhere. Just thinking about parenting and nursing, like, how would you say being a nurse has influenced your parenting style and vice versa? Because I know a lot of nurses, they either under or overreact to their own children, right? Like, a lot of us nurses will be
Hmm.
like, we're not, you're fine, you haven't broken a bone, you're not bleeding out your ears, you're fine. So there's the underreacting, but then there's also the overreacting because it's almost like you know too much, and every little thing could be 10 different horrible things. So how do you feel like your journey as a parent has sort of influenced your role as a nurse, and vice versa?
In so many ways, and yeah, you're right. I mean, it's a very classic nurse move to tell their child, like, yeah, if you can move that arm, it's not broken. We're not we're not going to the ER. I fortunately have only taken my kids to the ER twice, and my son was starting to turn a little bit blue, so I thought it was time to go. um,
Yeah, we are our delayed
yeah, no, it's
responses.
it's
Yeah.
classic. I think there are emergency rooms filled of kids who should have been there 2 hours earlier, and who have nurses and doctors as parents. Um, no, it's a great question. Being a parent has completely changed the way I am as a pediatric nurse, and I know that because I was a pediatric nurse for 6 years before either of my kids were even dreamed into this world. Um, and I think the first thing is that before I was a parent, I had a great deal of sympathy for these parents and their kids. Like, I felt very bad for them. I took care of them and I did a good job, and I was incredibly sympathetic. But after I became a dad and I realized how difficult it is to parent and just the joy it is to have a child, I could put myself in their place. I could understand, if not completely, but at least partially understand what they're going through. So I had empathy for what their plight was. And that completely changed the way I interacted with these parents and their kids. It brought me to a whole new level of understanding. And I think it helped them trust me as well. I think also that as a dad, I know how to talk to kids. I have to negotiate with my kids on an emotional level all the time. And being able to have that skill set and being able to take it to the hospital and really understand a child's fears and their motivations has been super helpful. I mean, I have spent so much time listening to the hearts and lung sounds of teddy bears before I even get so close to these kids because there's so many trust issues, and you don't want to be that nurse who just screws that up for that kid because these kids are going to be in the hospital for a really
Mm.
long time. A lot of them, It's going to be part of their lives. And that first caregiver that they get kind of marks how they're going to interact with, every caregiver that comes after. So for those kids who first enter the hospital for the first time with a new diagnosis, and for those children who are very used to nurses prodding and poking at them, I really want to, be a presence for them. I want their permission, and I want them to know that they're in a safe place. My compassion as a parent has truly brought me to a whole new level as a pediatric nurse. How has nursing influenced me as a parent? I truly don't sweat the small stuff the way other parents do. Like, you work in a hospital and you see kids with cancer,
Mm-hmm.
you kind of can let go a little bit. And I think that's sometimes a little difficult for my wife, who maybe has different standards of what needs to be happening at home. Another interesting thing is, not many people know this, but as a pediatric nurse, I take care of kids, from the ages of 0 to 18, as you would expect. But I also take care of kids who are in their 20s, and they're not really kids anymore, but they're people who have developed cancers when they're young, and they, through relapses and getting better and, getting worse again, they've, find themselves adults, in the cancer world, and we still take care of them. And then there are also adults who develop pediatric-like cancers, and we know how to treat those, so they come to be with us. So I've seen every kid there is, from 0 kids who just came out who have cancer to people in their 20s, and I've seen these milestones of life that have happened. They're often different than most kids would experience, but I've been able to kind of take these lessons from these kids, and in a not too subtle way, see how my kids are going to be at that age, and apply them to, how I parent them and how I interact with them. So it goes both ways. I'm really able to learn from the kids in the hospital and apply that to how I interact with my kids. And obviously, my skills as a parent are very useful when kind of interacting with the kids in the hospital.
When you become a parent, you probably can relate more to the parents of the children that you look after, because you have that lived experience now. Because
Absolutely.
I felt the same when I used to be a maternal child nurse. So I would look after women after they gave birth. And I think I really didn't know what they were going through until I did it myself. And it's just like you have that level of understanding that you have been through the same thing. So it just makes it like you're just much more relatable, I think, as a nurse, that you can understand what they've been through.
When I go into a room, I very often will mention to a parent that I am also a dad, and I can immediately see that they get calmer because they know that I'm a parent as well, and that I can understand their experience, and I can help them in a way that maybe it would have been difficult for me if I wasn't a parent.
So I'm hearing, like, of course, now I'm going to play like devil's
Please.
advocate, right? So like I'm hearing all of the like pros to, being a dad and having this type of experience, but what are some of the cons? Like, I mean, you can't be perfect because like I was sitting here, I'm like,
Who
damn, this guy's
told
like
you?
perfect. But like but I'm just like, what's the secret? But yeah, like what are some of the cons? Because I mean, like what are some of the cons? Because like, there's a lot of and it sounds to me like you are an expert pediatric nurse. It sounds like that is like you said, this is your calling. It sounds like, you've really found your niche. But I mean, this can't be easy.
Yeah. I mean, there's an extreme emotional toll.
Mm.
It sucks, I have to say. And I wasn't going to mention this. I mean, you guys talked about your weird days, but I had a patient die today,
Oh,
and
I'm sorry.
I was super close to him. It it's hard.
Yeah.
No, it's
Sorry.
fine. And what the way I always think about it is, so many horrible things happen in this world. This is such a crazy, beautiful, amazing yet horrible world. Bad things happen all the time, and just because you're not there to witness it doesn't mean they don't happen. So I'm so happy to be there to. No, it's okay. I'm so happy to be there in that situation and just be a presence and try to be a positive person for these kids. So it hurts, but it's a great place to be. With this particular teenager, it was yesterday that I last saw him. It's hard to find the words for how I felt when I saw his dad sitting at his bedside and holding his hand and kissing his forehead and weeping. And those are the moments that really get me, because I can see my own son lying there. So yeah, there's costs, and there's, there are hard days, and there are also great days, but I guess you have to take the good with the bad.
Mm-hmm.
I can only imagine how devastating that would be. And I mean, like our from our world in terms of maternal child and labor and delivery, I think the pain of losing a child, whether it's an 18-year-old or a 16-year-old, or a child who's actually never taken a breath, that pain is still so visceral. And being in the moment as a nurse at that point in time, it's really difficult. It's absolutely challenging. Like those are some of the moments that stuck with me the most. The parent who comes in and they're waiting that ultrasound, or they're waiting that time where they're actually gonna, they haven't had any fetal movement, and we know, like myself and Sarah know, we're just like,
Mm-hmm.
this is not going to be a good situation. And we put the toco on and there's no sound, and it's just like that visceral pain. We take it home too. Like, I mean, as much as we need to be in the moment for the patient, we're still human beings. Like, we're not automatons, we're not robots. So like we take that home, and it's tough. So I know it's a last question, but I'm gonna ask you it now. Like, how do you manage? Like, what are some of the things that you do to kind of reset yourself or press that reset button? Because it's not easy just to, like nurses do it all the time. We see a death and then it's like, oh, next patient. But like, how do you hit the reset button?
I mean, I think there's two things that we're talking about. I mean, how do you hold yourself in those moments when you're experiencing, or at least observing, somebody else's pain?
Mm-hmm.
And for me, like, I was super awkward about it when I was a younger nurse, because that I didn't know what to do with myself when somebody's crying in front of you or experiencing a great amount of pains. But then I realized that that was my awkwardness. It wasn't
Mm-hmm.
them. So for me to get past that, I just had to encounter it. I would, sometimes admit that this is an awkward situation, or, tell a person that I really hurt for them. And, people really appreciate it when you just come forward with how you're feeling about something. And especially these parents who, have so much pain within them. I think they really appreciate somebody being honest with them. I once had a mother tell me that, when I brought up her son who had died, that, it doesn't, every time you talk about him, it doesn't remind me that he died. I'm thinking about him every second. Every moment of my life, I'll remember that he died. Just you talking about him doesn't make it worse.
Right.
She said, I love to talk about him. I
Mhm.
want to talk about him. So there's that. But when I go home, how do I take care of myself? I try to focus on being healthy and eating right and exercising. My thing lately is I love to paddleboard, so I get out on the San Francisco Bay on my paddleboard and I fight the elements. Sometimes it is a psychic battle that's going out there. I'm fighting with something that I don't even know what it is. But yeah, I think really trying to keep in tune with nature and keep in tune with what my own body is telling me is a way to um, get past these moments. But life is hard.
Mm-hmm. Mm-hmm.
It's nobody said it would be easy. Nobody told me it was easy. I'm not sure how it's in Canada. Is it easy there?
That's a funny question. It's just different.
It's no different here,
Yeah.
except it's
It's
much
much colder, and
colder.
you have an attractive prime minister.
Well, that too. That makes it a little easier.
No,
No
no
comment.
comment. No comment. We might be speaking to him again, so no
Okay.
comment.
I like what you said though about just taking care of yourself, and just to get back to the loss conversation. I think no matter what it is a loss, right? Like we can't quantify or try to decide for ourselves what type of loss is easier or harder to accept, because I mean, you could always say, like, oh, well, at least he wasn't in pain, or at least this, or at least that. But the thing is, to a parent, a loss is a loss. It doesn't matter how old the child was, it doesn't matter how the child passed away. This is going to stay with them for the rest of their lives. And it really, I think, it's more important how you make the parent feel versus the actual words that you say. And I've heard this from other parents who have lost their children. So it's just about like being authentic and being in the moment, and just, you do make a big impact on this parent, because I'm sure if you talk to some of your patients' parents, 5 years from now or 10 years from now, they're still going to remember you and your face. So it is like we do have a really important job. And I think that even everything you're saying about just understanding what they're going through is really important.
People kind of try to label the grieving process for when a person dies, but that grieving process starts from the moment of diagnosis
Hmm.
all the way till if they survive or when they die.
Right.
Parents grieve their kid not going to school. They grieve their kid not having a ponytail that they can put into braids. There's so many losses, and it's continual, that you can't just say, I'm sorry for this, I'm sorry for that. It just it's so
Mhm.
complicated.
I think that it's good to talk about these things, and it's good, and I think it's been eye opening for me, at least in terms of some of the perspectives that you bring to the table when it comes to dealing with a child or losing a child. But maybe I will try to turn it a little bit to make it not so heavy. And actually, it's bringing me back to one of the points that you made about, like, sometimes we as nurses tend to be, like, we are like the last people to bring our kids to the ED. And I am definitely one of those people too. And I think it's kind of interesting because you said it didn't translate to your wife, but it definitely translated to my husband, because my son, he was so I have twin boys. I have twins that are 9. Oh my gosh, I do know their ages, and a daughter that's 5. And I believe I was at work or whatever, and I get this text message saying, like, I'm taking Tristan to the hospital. I think his arm is broken. I'm like, what do you mean his arm's broken? And like, I don't even know. Like, I'm not even there, but I'm just like, no, his arm's not broken. He's fine. And essentially what happened was he was swinging on monkey bars. So like going to swing from one to the next one. And he fell down to the ground, and I guess he fell awkwardly, and my husband's like just yelling at him, "Get up, get up, you're fine." And he's walking home and he's crying. And my husband's like, "Suck it up." And then he looks down and his wrist is all like not how it should be. And he was just like, "Oh God, my wife's nursing is translated onto me." And I mean, like, I feel like, yeah, I'm a victim to sometimes not being as cognizant. And maybe it's also the nurse in me that I'm just kind of like, yeah, you're not, there are kids that are sicker than you, but sometimes, like, I don't pay that attention, and I know I need to do better.
Yeah, I mean, we're all guilty as parents of missing things about our kids.
Hmm.
Was it a broken arm?
It was, I think so, it was like a broken, it wasn't his wrist, it was like I think it was the tibula or fibula, one of the two, that had just like a hairline fracture. So
Okay.
he wore a cast for around 4 to 6 weeks. But I should have I should have done better. And then it's kind of funny, same son, when he was around 2. My both of my twins have asthma, so I had them early. I had them at 31 weeks. And again, Tristan was sick and he's coughing. I'm like, oh no, it's fine. Just humidify him, bring him to the shower. He'll be fine. And like you said, it got to the point where his lips were blue, and I was like, oh, okay. I think I need to take him in. And it was actually just luckily that I had known a pediatrician. We kind of fast tracked because I got the nursing card going for me, and it was so bad that essentially he needed like a 3-4 day stay. He
Oh,
got
wow.
a IV in his
Oh,
scalp, and I was just
damn.
like, how did I miss all this? I'm such a bad nurse. But it's just like, when it comes to my parent, and maybe that you could speak to this, when it comes to me being a parent, I'm a parent first and then a nurse second, whereas like at work I'm a nurse first and a parent second. So it's just kind of like, how do you manage being, a dad first and not the nurse person first?
Well, I mean, first of all, I don't think there is a separation. I think they're the same thing. That's where the nurse papa persona comes in. But your your description of a IV in his scalp really brought back a memory to me, out of nowhere. I was taking care of this kiddo. His name was Tony. He was a 2-year-old, and he had this giant head. Um, I don't know why. I think it was a developmental thing, and the only place we could ever get an IV was his scalp.
Oh
Um,
dear.
this kid went through a few different bone marrow transplants, and I remember when I was a night nurse back then, I was taking care of him, and he always slept in bed with his grandmother because his parents were MIA. They just were not around. It was always
Wow.
his grandmother and grandfather who
Oh, poor
stayed with
kid.
him. And I was in his room like at 3 in the morning, and like I said, I try to like be kind to these kids, and I want them to know that I'm there. I'm not just entering their space without asking. So I grabbed his little foot in bed and gave it a squeeze, and then I heard this voice, and it was his Tony's grandmother, and she said, "Hi, David. That's my toe," which is just about the same size as Anthony's foot.
That's hilarious.
Oh god, that must have been horrifying.
It was actually pretty funny. She was such a great lady, so she didn't mind. I don't know if there is a separation. I think that for me, being a dad and being a nurse, they're all part of the same continuum of not really feeling comfortable wherever I am. And I'm okay with that. Everybody wants to feel that they are who they are right in that moment. And it's just not that clear cut, right? Sometimes it gets confusing. And sometimes I feel like I'm a really great dad, and I'm quickly disabused of that by my children. I'll lose my temper, or I'll say something that hurts one of their feelings, and I carry that into my nursing. And, there are times when I have these relationships with these kids, and I feel like I'm doing the right thing, and I'm just not. And it's all about kind of owning up to these mistakes and allowing them to make you to be a better person, I think.
The way that you parent your kids, I mean, undoubtedly is different than how you look after your patients, because even just parenting healthy children versus sick children, I think you take on this whole different this whole different approach. And so what you expect of a healthy child is very different than what you would expect with someone that has an illness. So I think it's just, for me, I could see a lot of like flipping back and forth. Um, so I think there's a lot of that happening as well. And even just like you mentioned, you had a patient that passed away, like having to sort of like, I don't want to say turn it off, but like go from that to just going home to your kids and being with them and playing with them, and then having to come and do this podcast with us. Like it's a lot of switching, I guess, emotionally for you.
I was looking forward to the podcast.
Well, what? It sounds like you have a pretty good sense of humor too. So, I mean, I think that probably also helps as well. It's just you can't always take it all on, and sometimes, not saying that you would laugh at someone's death, but sometimes you need to laugh to just kind of say, hey, I need to change it up emotionally for myself, and I think that's okay too. Like I think we can't, like I think if you were to take it on all the time, or if myself and Sarah were to take on some of the things that are said to us, or some of the things that happen, that we'd be pretty sad people.
Oh
And
yeah. I mean, you find so much happiness in the place where I work. I don't think people understand. You're
mhm.
working with children and they are just amazing. And you're also working with pediatric oncology nurses, and they have the darkest sense of humor. And I think it's what you have to be able to make it through the day. Oh my gosh, I'm not going to tell you the things we talk about in the break room, but it's it's funny, but it gets dark because you have to encounter these really dark things,
Mhm.
and the only way you make it through that is by laughing. I think every comedian out there is actually a very sad, depressed person, and they're comedians because they're trying to like bring light to their own existence somehow. But yeah,
I hear
the
you.
funniest things happen. I remember one time I was taking care of this young man, and he was getting a therapy that was kind of designed to like bridge him over to bone marrow transplant when we need to get him in remission. But the therapy was really dangerous. Like the therapy could kill you, which is actually something that is a sad reality. And so I had him hooked up to all these like different monitors. I could see his breathing and his heartbeat, every all his vitals at once. And I looked at his monitor, and all the bells went off, and he was like apneic. So I ran to his room,
Oh man.
and he was just sitting there watching the basketball game. And I'm like, "What's going on? Are you okay?" He's like, "Yeah, I'm fine." So then I left the room, and then I went back to wherever I was doing. 5 minutes later, apneic again. He's not breathing. I run to his room, and once again he's completely surprised by what's going on. So eventually, I figured out that every time the point guard went up for a shot, he would hold his breath,
Oh my
and the
gosh.
monitor would read apneic. So
Oh, you got your steps in that
I got my
day.
steps in. I turned off the monitor until the game was over.
Yeah, seriously.
But stuff like that, and much more minute funny things happen all the time, and it's just a function of working with kids.
You need to tell us a little bit about your book.
Yeah. So the book, like the podcast, is called Nurse Papa, 16 Meditations on Parenthood from a Pediatric Oncology Nurse. And I started writing it about 5 years ago. I had no idea that writing a book would take 5 years, but apparently when you have a job and you are also trying to be a dad, it takes a
I
while.
can imagine.
Yeah. Are you guys working on any books right now?
It's funny you should mention that. We've been talking about this for like, actually we've been talking about this since the fall, but we have not even broken ground yet, although we've interviewed a number of people who have published books, and it seems to be quite the process. Like, we talked to someone a couple weeks ago, and she said that editing took a whole year, just the editing of the book. I want to write, but it seems like something I'm not quite ready to dive into just yet. I'm not sure about you, Amy.
We just do our angry op-eds every once in a while, and that keeps us sated for now. It's just like
800 words at a
yeah,
time.
we'll just
I mean, I think starting off with stuff like that can lead you on a path to kind of a larger project, right?
Mhm.
yeah, I don't know. I don't know where we're gonna find time between, because it's like we do our podcast, but then we do all the advocacy stuff too, right? That takes up some time. And then,
Hmm.
somewhere in the background I have kids and a husband and I go to work. So I mean, maybe one day, who knows? Who knows, Sarah,
I
right?
know.
Yeah, my wife. So after spending 5 years writing this book, and bringing her along with me on the ride, right? She's my emotional backstop. Like, I can't do anything without her. She's also was my first editor. So I finally found a publisher for this book and was, on my way to getting it published. And then I decided to start, the Nurse Papa podcast. And she's like, "You spent 5 years writing a book, and now you're starting a
She's like, you better
podcast."
get that book out.
So like, yeah, get it out. But yeah, so it's been a real experience for me. And I've been, the whole idea behind the book was kind of taking these rare lessons that I've learned from kids and parents at the bedside, um, and tried to apply to my own life as a parent. And they're not like heavy-handed lessons, but they're more about a way of being. In one chapter of the book, I talk about how one of my patients one day, he asked me, he said, "David, have you ever seen a ghost?" And I said, "Well, I have not seen a ghost, but if there was going to be a ghost, it would probably be in a place like this." And I immediately regretted what I said because I didn't. I was used to speaking off the cuff with this kid. We were very close, and he didn't have too much family around. And whenever he was scared, whenever he needed somebody, he would call for me, and I would go hang out with him. And so this opened up a whole bag of worms for him. And he said, "David, did people die here?" And in my mind, I was like, "Yeah, of course they die. You're gonna die." Because he was so sick. And I didn't know what to say to him in that moment. But what I came to is that I had to tell him the truth. I said, "Yeah, people die here." And then he said, "Do people my age die?" And he was 11 years old. And I said, "Yep, people your age die." And then he went back to playing his video game. I think that was kind of
Typical kid.
as far as he wanted to go with that line of questioning. Yeah, but what I learned from that was that you have to tell your kids the truth. I had the same situation with my daughter. She was 3 years old and she was sitting over a mushy bowl of Cheerios, and she looked up at me and she said, "Papa, I don't want you to die." And I said, "Baby, I'm gonna die." It didn't it didn't horrify her, although I was happy to see that she seemed slightly sad about the fact that I was gonna die. But these interactions I've had in the hospital have really clarified the way I want to, excuse me, with my kids, as a
Mhm.
parent. So that's what the book is all about. And in between all these stories of sadness and triumph, there are also lots of funny moments that happen too. I tried to fill it with every emotion on the realm to let people know that you know being a pediatric oncology nurse is not a monolithic thing. Funny things happen, horrible things happen, and they're all part of being a human and being a nurse.
Wow.
Mhm. I think working with kids and being a parent, it just prepares you to answer all different kinds of questions at unexpected times. Like, my son has been, it's funny you brought up the death conversation, because my son, who's almost 6, has been talking a lot about death. And not a lot, but I would say like once a week to once every other week. He'll say, "Mommy, will you be sad when I die?" And I'm like, "Well, I probably will die first." So that was like a revelation to him that, I am older, I'm going to die first. And it's funny because his best friend at school flew back home to Jamaica when his grandfather passed away, and he's a very outgoing kid. So he actually saw his grandfather in the casket, being lowered into the ground for the funeral. And he looks up at his mom and he says, is Grandpa going to heaven? And she says, yes. And he's like, well, if he's going to heaven, why is he being buried down here in this box?
Why is he going into the ground?
And his mom lost it. I don't even know how she answered that. But it's like these types of questions about death, they're very honest, and you just have to, like, there's no sense in coming up with a story. Like, it's just best to tell the truth. That's my approach for everything. But it's like saying it in an appropriate way that's the challenging part.
I'm very comfortable with my kids knowing that I don't know. I mean, I think some people try to hide the fact that, they are fallible people or fallible humans, and every human's fallible. You don't grow up and like suddenly have things figured out. I mean, I was a mess earlier today, and I'm okay with that. That's just the way it is, right?
Mm-hmm.
I try to pull it together for my kids. Like, I don't bring them that pain. Like, I'm not going to tell my kids I had a patient die today. Although if they asked, I would tell them. And my daughter, she's super smart. She consents how I'm feeling, and she will ask me questions. She asks the most amazing questions. She said, Papa, if kids are sick in the hospital, can they still play? And I thought it was such a great question to ask because, like, it's not obvious,
Mm-hmm.
right? And I told her, yeah, I mean, I think one of the reasons that kids feel better is when they can play and they can kind of forget that they're feeling sick. So there's always a lesson out there for us and for our kids.
Wow, I feel like I've taken a lot away from this. Even just like, I mean, you haven't sold me on becoming a pediatric oncology nurse.
As long as I sell you to buy my book.
But yeah, absolutely. No, it definitely sounds like something that I would love to read, and definitely we'll share it on our socials. So when is your book coming out?
The book does not come out for a while. It does come out August 18th, 2021, which is why, and this will answer my wife's question as well, why I started the podcast. Because Nurse Papa the podcast is very different from the book. It does kind of mention some moments in the hospital, but it's really about normalizing the completely crazy experience of being a parent, because it is so nuts being a mom or dad. And I feel like a lot of these podcasts that are parenting podcasts try to talk to parents from a high place about what they should do. But the Nurse Papa podcast does not do that. In each episode, I bring you to a story of parenthood, and I hope to come out on the other side with like some moment of clarity. But I'm not telling you that this is the right thing to do.
Right.
In the second half of the episode, I do tell you what to do. because in the second half, I basically answer a letter from a parent listener about their own personal parenting conundrum. But I don't do it in a way that is accusatory or even assumes I have any idea of what I'm talking about. But I hope to bring some kind of levity to the experience of being a mom or dad.
Awesome. So where can people find your podcast, or where can they follow you?
They can find the podcast on any major podcast platform, Apple, Spotify, Stitcher. I'm not sure what platform you guys like to use. And they can find out more about the book at nursepapathebook.com.
Sounds great. Definitely something that we will check out, and definitely something we will put on our socials to get our listeners to check out as well. We're all about helping each other, building each other up. And I mean, this offers something that we can't offer. So I mean, absolutely. Let's push all the parents towards in your direction and make sure we hope you all the success for your book and for your podcast as well.
Yeah, and any Canadian parents who have some questions about parenting, if you write me a letter about your question, I will put you on my show. So you can write nursepapathebook.com, and I will do my best to enlighten you about what I think is the best way to get through your hard times as a parent.
That's amazing.
Awesome.
I like that. Maybe we should send some anonymous letters, Sarah.
It's funny because I don't know if you have this in the States, but in Canada, if you write a letter to Santa, like a handwritten letter, you always get a response. And so I feel like this is like parents writing you instead of Santa. It's Nurse Papa.
You're so funny.
I will not send back coal.
No, and the letters are different every time. I got 3 different letters for my kids. But now they know that Santa doesn't exist. So that's fine.
So my daughter has no desire to write a letter, but she does want to catch Santa, and she drew an elaborate map on how she was going to do it. And I said, "Boo, what are you going to do with Santa when you catch him?" and she did not have a clear answer for that. So we are working out what her plans are. She's also trying to catch a tooth fairy.
Okay.
So lots of things going on in the Nurse Papa household.
Sounds good. Oh my goodness. Well, thank you so much for coming on to the Gritty Nurse podcast.